Hello, my name is C.A. Murray, and welcome to Coronavirus Report. I'm in the company of Pastor Stephen Bohr and our resource person, Dr. Milton Teske. Good to have you gentlemen here. When we did our initial program, it occurred to us that we might do well to give you updates each week. The situation is so fluid, so dynamic, and has so many changes and so many wrinkles and so many nuances, even things that we forgot to talk about, that we thought we would do well to bring you continual reports as long as we can and as long as this emergency lasts. As things come up, as new information comes to the fore, we wanted to make sure that you're aware of it, and anything that can affect your life, your work, how you live and what you do, if we can help you with that, we wanted to do that. So gentlemen, we want to sort of launch out. Pastor, I know you've got a number of questions, I've got a number of questions, and we know that the good doctor has the answers. We pray that he does. And perhaps we should invite you, if you do have any questions, to call Secrets Unsealed SUMtv and leave your question, because there may be something in particular that troubles you and that perhaps we can help you with. So Pastor Bohr, what do you got?
Okay, Dr. Teske, I have a question. You know, you have a lot of talk on television about flattening the curve.
Yes.
So the question is, what does that mean, flattening the curve, and how can the curve be flattened?
Yeah. So if you graph out on a graph the epidemic that's occurring around us now, what you find in a local, any given area, over time, it starts doubling. You get this steep curve that goes way up really high. Eventually, that doesn't keep going forever. Eventually, you run out of people to infect, and it comes back down. The problem is, this curve is so high. Up at the high parts of this curve here, up at this when it's in, the amount of people getting sick, the amount of people needing hospitalization, the amount of people needing an ICU, the amount of people needing to go on ventilators, far exceeds the number of hospital beds and ICU beds and ventilators available. And we've seen evidences of that in Wuhan in China. We've seen that now in Italy. And we really don't want to see it here, although we're starting to see it down in New Orleans just recently. We were a number of doubling times out from the Mardi Gras celebration they had there. They didn't cancel it. They brought in 1.4 million visitors from out, and they all congregated and partied there for some time. And now the results of that we're seeing in the local epidemic there. All of these epidemics, although we look at them as a whole nation or as a whole world, they're all local epidemics that are occurring here, there, and wherever. You know, the pandemic component of it is the fact that, yeah, it's spreading everywhere, but it's not spreading everywhere equally. There are many places. Here in the Central Valley of California right now, we've got a few cases in Fresno, a couple in Hanford, a few in Madera, but by and large, we're still ahead of that curve. We haven't gone up that curve yet. And the idea is we want to flatten that. In other words, we don't want this steep climb. We would like to slow it down, delay it. Even if it's eventually going to get here, we would like it to get here real slow and gradual if we could, rather than all over a period of a week or two and not have enough hospital beds and ventilators for everybody. So if we can slow it down, delay it, and get a much more slow, gradual rise over time, then we're not going to exceed all of those hospital, capacity issues and ventilator capacity issues, and as well as the longer time goes, the more study they've done, more we know which things help and which things don't help.
So a follow-up question. So when you say that when the curve reaches a certain height, it starts going down because there's no one else to infect. You know, in New York, you have like 50 or 60,000 people infected, but there's millions of people that live there.
Yes, but that 50,000 that you're saying are infected are the ones they've actually tested and got a positive test on. We don't know how many haven't been tested and still have it. Apparently a large number of people get very minor illnesses with it, and sometimes as much as 30%, some studies are saying, actually have no symptoms, but yet they're infected and spreading the virus. And so there's a real problem. In other words, it's spreading through the community and much larger numbers that end up in the hospital. It's just that there's a certain percentage that are going to get that sick, and their life's going to depend on additional respiratory support or ICU and ventilator support to survive this. And we'd like to have enough ventilators and ICU beds for everybody. But if everybody gets sick at once, there's not going to be. And in Italy,
Sure.
you know, I'm hearing stories where they're just, they decide who gets a ventilator and who doesn't, you know, and everyone else, they get put in a room, but they know they're going to die because they're not supporting enough support to keep them going. And we really don't want to see that here. We're not there yet here, but we're really pushing it. Read a report just yesterday from an ER doc in New Orleans, and they've got every bed, you know, they're swamped there in the ER. They've got every bed in the hospital beds. They've got additional capacity hospitals that opened up, you know, 50 beds here and 50 beds. All of those are full already. Wow. And the curve is still going up. They're still shooting up here. So hopefully, you know, the nation's putting all their resources into this to try to get more supplies, make more capacity, you know, move some patients, whatever we can to try to take care of everybody and get everybody through this, you know.
Yeah.
It's one thing that should be able to bring us all together is, you know, when people's lives are on the line, what can we do? And so what are the things that flatten that curve? What slows it out? Well, what slows the transmission? And most places now that have any significant infection, we have what we call shelter-in-place orders. It's a type of self-quarantining sort of thing. Everybody is supposed to stay home and not go around other people because you catch it from other people. And so if you don't go around and socialize and congregate in churches and in sports arenas and at schools and any other public place that you don't need to, we can slow that curve. In other words, it's not going to spread to everybody because we're not meeting at the same frequency. And so somebody that has it isn't going to be meeting all of these people. He might meet one person here or something, but it won't be as many. So the more we can obey these rules that they're putting out, these these stay-at-home orders, really that's probably the most important thing we can do right now is to stay at home. Don't go out and congregate. You know, if you need to get some food at the grocery store, you know, limit it, go through, don't congregate with people, stay your distance in line, and you know, pass on through and try not to get infected. Try not to affect anybody else. You don't know you don't have it because many people get no symptoms at all, and many people that do get symptoms were probably infected days before they got their symptoms and were spreading it for several days. And so, you know, do everything you can to prevent the spread of it. That's how we flatten the curve. And there's lots of little strategies the health departments are working on, and the cities and the state governments and the national government are all putting out trying. Everybody's got their efforts on this, but it's important that we do that so we, you know, move it, you know, out, spread it out, space it out, so there'll be an ICU bed when you need one.
Oh, okay,
Praise
good.
the Lord. Just to follow up on Pastor Bohr's question, because we see this bell curve in some areas does not necessarily mean we will see it in every area. Is that not so?
The only thing that will keep us from seeing it in other areas is the very things we were just talking about, these ways to mitigate it, to slow it down, to block it back, because it is very infectious and it is going to spread. People move around, they travel, one person gets it here pretty soon. And at first it goes slowly, but each, you know, few days when it doubles, it goes up farther. And then you double that number and it's up to here. And so epidemics accelerate. And it's going to accelerate here. It's going to accelerate little teeny towns in the middle of nowhere. You know, if we look back at the 1918 pandemic, you know, as that influenza spread around the world and millions died from it, while it hit certain areas first, just like right now it's hitting New York and Washington and New Orleans and LA, it hit, you know, it was hit Philadelphia, and then it went to other cities. But it eventually was wiping out little villages of Eskimos up in, you know, Alaska and other places. It keeps spreading. It keeps spreading. It only takes one virus to somehow get somewhere that somebody picks up and brings back, or somebody brings in, and then it spreads through that area. It's a very infectious virus. And at this point, the whole world is still not resistant. There's no immunity to this virus. It's a brand new virus out there that the world hasn't seen before, and it's going to keep spreading until everybody gets infected and becomes immune, or until we get a vaccine that can protect people. But until we have immunity out there, it's going to keep doing it. It's just a matter of when it does it and how fast it does it. If there's anything we can do that will slow that down, that'll be real life-saving. It doesn't have to keep going up. If we stop the spread, we can break that. But it's those type of public health sort of things that we do that's what's going to break that curve. That's going to stop that acceleration.
You know, I was doing a little research on this. And what I read was that in Philadelphia on September 17, 1918, they detected the first case. And I'll read. They gave a law against coughing, sneezing, and spitting in public. But 10 days later, they had a parade where 200,000 people attended.
Yeah. Yeah, like New Orleans, they found out the hard way you can't do those kind of things.
Yeah.
And when the government comes in and says all the schools are closed, all your churches are closed. I mean, today we've got live streaming, we've got video, we can, you know, got the internet, we've got all kinds of ways to not be in total social isolation. But when you start congregating together, the same thing now as 100 years ago. It's the same thing.
So, Doctor, social distancing really then has to be at or near the top of the list as far as flattening, as far as trying to keep the thing from spreading. This is not a joke. It's not more than a notion. It's something that we really have to do.
No, it really is the one thing that will break this curve. You know, we can do our best to get medications to mitigate it. So far, we've got a number of drugs everybody's trying. I'm hearing some reports that they're working. I'm hearing other reports that, yeah, they're helping a little bit, but, you know, it's not like, boom, magical cure. So, you know, vaccines are coming. They're starting some trials of some, but that's all down the road in the future. And until we until we're there, the only tool we've really got is these mitigation methods, this distancing, this don't spread it to somebody else.
You know, I'm really concerned about this area, which is not heavily populated. My wife and I went out this afternoon to buy some groceries. It's amazing how many cars are out there, how many people are in places that are open, you know, like the home building companies and the supermarkets. I mean, traffic is just as usual.
Yeah.
And it wasn't that way when they first said stay at home. In other words, people have a tendency to slacken off.
That's very true. We noticed it yesterday.
Right, and because, hey, nobody you know is sick yet. Nobody's sick. I've got a good friend, an emergency physician up in Washington, who is now very, very sick. You know, he's picked it up through the ER there. But once it starts spreading through the community, what really slowed down and got people doing the social license 100 years ago was people got scared when people just started dying all around them and relatives, and everybody you knew was dying. Then suddenly people were scared. Of course, then it's too late.
Right.
It's already everywhere. Right. In other words, the only way to make these things work is to do them before it gets bad. So here in the Central Valley of California, it's not too late to get ahead doing this stuff.
Right.
But we've got to take it seriously and start doing it. One thing that's been discussed, maybe we should talk about, is masks.
Yeah, that was my next question. Masks.
Yeah. Well, this is the right spot to think about that. When this first started out, the Surgeon General got up and announced that you don't need to worry about wearing a mask because it's not going to help. And then a couple of sentences later in that same announcement, he said, we need to save all the masks for our healthcare workers because they do work. And well, the bottom line is this virus spreads, there's a droplet spread, there's probably some degree of airborne spread. Masks do make a difference. There's different kinds of masks, different degrees of masks, but masking is something that can make a difference. We see in Asia, in China, Hong Kong, Singapore, South Korea, Japan, they're very extensively using the mask. And in some of those places now, they've actually gotten pretty good control. They're flattening out that curve. They're slowing things down. It's not gone yet, but it's not the raging, epidemic like we're seeing here where things are still climbing. There are different kinds. There's what they call an N95 mask, which really filters out the viruses and everything. It makes a tight seal around there if you put it on right, and can really be extremely protective. But there's other degrees of masks. I mean, there's the typical paper, what we call surgical masks that surgeons use in the operating room all the time. And for most cases, those are probably going to be very effective in terms of spreading, protecting you from droplet spread. And even there's on the internet, you can get the plans to make them out of old T-shirts or whatever. A lot of different materials that you can. Somebody's even done a study of all the different materials and which ones filter how much and which one's better. I think at the top of the list was the vacuum cleaner bags used as a filter material. Making these masks and so that they seal around there and stuff is a way of protection. But probably more important than protecting yourself from the other germs is they're going to protect other people from you, because you're not going to know when you've got it. You think you don't have it. You think you haven't been around anybody, but so does everybody else of these, and most of our cases now are kind of these community-acquired cases. Well, they didn't come from China. They just came from downtown somewhere. They came from the grocery store, the gas station. We don't know where they came from, Somebody you met and talked to. And who knows who's got it? You don't know you've got it. Yeah. And you won't know until you get symptoms. Some of you won't even get symptoms, but will continue to spread it. If everybody put on a mask, all of that would stop. So,
where do you get a mask?
Now that is the challenge. And, masks were universally available at every pharmacy and Home Depot before this episode. Now everybody's hoarding and buying up, and you can find somebody that hoarded some. They'll probably got a lot extra to share. There's a lot of businesses still carry some. But you can make your own out of these cloths. I mean, you can wear a bandana, There's some very simple things that can be done that will make a difference. And we had a long conversation just yesterday among the health officers of the various counties here in the Central Valley. And we're all seriously considering even possibly putting that out as a mandatory, order. That's still under discussion, whether to make an order or just a recommendation, but we're really to the point where we want to do everything we can, and things are increasing, and we really don't want it to get out of control if we can stop it. And here's something very simple that can be done that can help us keep it under control. It can help protect you and your family. So I recommend it when you're out in public to go ahead and use the masks.
Yeah. Good, Doctor. Here's something I've not heard that much about. In fact, I think the first person I heard it from was you. This idea of sense of smell as being a symptom that you have. Talk a little bit about that, if you will.
Yeah, so when we think about what are the symptoms of this infection, everybody thinks of fever, headache, body aches, those flu type things, fatigue.
Dry cough.
runny nose, you start coughing. Of course, it can progress to shortness of breath and pneumonia and become more serious. But interestingly, apparently the virus, as it's going in and infecting the nasal mucosa and the other tissues and starting to spread, up in your nasal mucosa is where all of your sensory cells are for your sense of smell. And these olfactory nerves goes up to the part of your brain where you sense smell. And as the virus attacks the mucosa in that area, it's damaging those cells. And we find maybe as many as a third of the patients lose their sense of smell. They can't smell even very strong smells, you know. You got a chef and he can't smell curry, you know, and he can't smell garlic. I mean, he's the one, you know, these are people with acute sense of smell. They can smell a dish and tell you exactly what herbs and spices are in there, and suddenly he can't even tell you if there's garlic in there or not. You know, and not only the sense of food, but even other noxious scents, you know, putrid things you wouldn't want to smell and be around. Suddenly, you don't smell those or notice them anymore because we've destroyed those nerves up there and damaged them badly, and they're just not the sense of smell, which also blunts your sense of taste because much of taste is actually smelling. It's the aroma of the food, not just the various taste sensors on your tongue that are triggering that. So suddenly the food tastes bland. It doesn't have the flavor it used to, and you can't smell the flowers or the perfume anymore. That's a real telltale sign that, you know, this virus is in there doing its job. And in many cases we see this and they haven't had the fever or the cough or some of those other things yet. So, you know, it's something to be aware of and to think about, and something that give you a cue that, hey, I'm sick. I need to be really careful and isolated.
I wanted to ask you about sanitizing other things. You know, there's a lot of talk about washing your hands, you know, after you touch anything. But what about sanitizing products that you buy at the supermarket, your shoes, the bottom of your shoes when you go into the house, the doorknobs?
Certainly things that you touch regularly should be cleaned. This virus can stay for several days on a hard, you know, smooth surface. And so if someone else coughed on something and, you know, and they've got it on their hands or it's on some product that you pick up or whatever, and then you touch it and now you've got it on your hands and you rub your nose or your eyes, you haven't washed your hands over and over and over like we're saying now. We are, you know, putting yourself up, you're getting infected, and it only takes, you know, a few viruses to get in there and get a few cells, and then they make thousands of more, which spread to the cells by them, and a few more doubling times, now you've got a cough and a runny nose, and it can keep going. So sanitizing things in your household, particularly things you're bringing into your household, whether you're going to sanitize the soles of your shoes and your floors, that may be going a step over. In the hospitals, we are continually going around and mopping and cleaning the floors with disinfectants, though. So it's certainly appropriate to mop your floors and, you know, keep things cleaned. You know, use disinfectants in your, you know, cleaning solutions and stuff.
What about the difference or the effectiveness of soap and water versus the hand sanitizers that say 99.99% effective?
Yeah. The bottom line is soap and water like this, when they're running water or some soap, those viruses are gone. You've washed them all away. They say 20 seconds. Good way to remember that. If you wash the front of your hands, and then you wash the back of your hands, and then you wash between your fingers, get that good, rinse that off. By the time you've gone through that ritual, you've got your 20 seconds. Your hands are clean. The hand sanitizers, everybody says, well, that's second best. You know, you're not by a sink, you're not something, well, hand sanitizers. You know, 70% alcohol is usually enough to kill the virus. You want to make sure you've got it on everywhere and got it on the virus, not just a little bit in the palm, you know, their hand. But yeah, the hand sanitizers are good, but the waters and soap's the best.
Excellent.
Yeah. I knew we were going to run out of time before our questions were exhausted, but you perhaps have heard that one of our conference presidents in New York City has been diagnosed positive.
I haven't heard that, no.
Yeah, that came out just this weekend. And one of the things that we're discussing was the length of time from the time he got his test till he got his results. There was evidently a protracted period of time. I'm told that there are some new faster tests and ways of getting the results back faster.
Right. And even the old tests, the ones we've been using, don't actually take many days. They actually take several hours to run. The problem is we only had a few machines, a little bit of reagent, and even when you get then it's got to be sent to some lab, and then it's in their to-do list, and eventually they're going to get to it as soon as they can. And so I had a patient, a positive test, and it came back a week later. Well, during that week, he's been here and there and everywhere, went to another hospital, got diagnosed and released, and still, now we got our test back. Now we go back and tell him, no, you're not negative, you do have it, and now you got to, So it creates a lot of problems, this delay in diagnosis. Just over the last week, they have really increased the availability. Many of these labs now have multiple modules on the machine. They're running many more tests per day. And there are many more labs coming online now that are doing it. They're huge. The UC system here in California, they've got big laboratories there that can run 10,000 at a day, type of thing. It's really vamping that up. And there are some instant tests available, but you're going to find if you go to get one, it may not be your doctor happens to have an instant test in his office. But they are rolling those out. They're making them by the millions. They are going out, and over the next week or so, we're going to start seeing more of those becoming available where they can run a test in a few minutes. There's two different kinds of tests out there. One is the test that actually tests for the virus, and that's the one that we've been using with the various swabs and doing that. But there is another one you can do on some blood. You just a serum sample of blood, and you look for the antibodies. This is going to be real important as we move ahead, because for all of you people that weren't that symptomatic, this is going to show that you were infected and that you are indeed immune. And so that you're safe to go back to work. You don't need to be afraid of getting it now. You've already got the vaccine, in a sense. You got the real thing, and you're now immune to it. You're protected from it. And so that's our hope, to see that roll out in that area, and really help us in the tail end of it.
Pastor Bohr, you got about 30 seconds to take us to the Word and leave us on a positive note.
30 seconds. Next time we want to talk about treatment.
Okay.
The effectiveness of treatments. One of those is lifestyle.
Yeah.
And so being that we have just a very short few seconds, I want to read one verse in the Bible, 1 Corinthians 10, verse 31, which I'm sure that you know very well. It says, therefore, whether you eat or drink or whatever you do all to the glory of God.
Amen. Join us again soon for Coronavirus Report.